Nizar from Cleveland Clinic, who is Head of Global Patient Services. Nizar, tell me a little bit about your role and what that entails.
Absolutely. I have been lucky and privileged to have been involved in the care of international patients that come from many different countries around the globe to Cleveland Clinic for medical care. We receive patients from about 130 different countries each year, many of whom speak only their own native language and do not speak English. So the department I oversee takes care of these patients who wish to travel to the US for medical care.
And how do you find your patients? How do you market to your patients and let them know about Cleveland Clinic and all that you offer?
In the future, we will continue to rely heavily on our reputation. So our focus has always been safety, clinical outcome, and patient experience. And if we keep that vision and mission in mind, patient will ultimately want to come and seek medical care when needed for certain selected cases to Cleveland Clinic. We have evolved from a medical center that mainly housed in Cleveland, Ohio, to expand nationally to Florida and to other locations, and to expand internationally to Canada, to in the near future London and China, and to Abu Dhabi in the form of major medical centers like Cleveland Clinic Abu Dhabi.
What sort of technologies are being developed to kind of help with patient experience?
There are unique needs for the international patient who travel outside their own border for medical care. These needs go beyond the medical need into language interpretation, and for that there are a lot of newer technology in addition to an interpreter, a human interpreter. There are technologies evolving now in the future that would allow patients to use artificial intelligence to communicate in a different language without the need of having a human being with them all the time. Another unique need for international patients is hospitality services. So when somebody travels outside their own city and borders, they need housing, they need transportation, they may need a bank account, they need to know where to go to get food, a lot of newer technologies in the form of apps, local applications, would allow patients to navigate through these difficulties a lot easier than they have before. So evolution in telemedicine is also helping in providing care for these patients, in improving patient experience.